as he. Thank you very much for letting us know that. I'm pleased with working with Jordan for the last several months as he was working with people at the Regional Cancer Center, adapting a piece of software called SeamlessMD so that it's suitable for people who are dealing with cancer. And the new adapted app will be called SeamlessOncology. The Regional Cancer Center received funding from the province to do a pilot on this adaptation, and it's now in operation, I understand. It will eventually be refined, and hopefully then will be shared with other cancer centers across the province. Jordan worked with a group of people from the Regional Cancer Center as they went through the SeamlessMD app and made those appropriate adjustments to it. Jordan, as those who've been on for the last few minutes know, can see that he's a very friendly, very open guy. Very nice to have with us. He is the customer service manager with SeamlessMD, which is a software development company. He graduated from the Schultz Business School at York University. And in his final semester, he was on an exchange to France. And I'm sure that enabled him to improve his French language. And that's why people like Mark and Marcel may want to have a private conversation with him. Jordan was married in the fall of 2018. He's already told us that he likes the Toronto Maple Leafs, as well as the Toronto Blue Jays and the Raptors, a real Toronto fan. And he has frequently participated in fundraising rides, raising funds for cancer. One of the comments that Jordan has made on his bio is that he considers himself to be a resourceful problem solver, a creative thinker, and overall team player that will collaborate on any given project to produce key results. And from my time with Jordan over the last 3 months, he certainly fulfilled that definition. So welcome, Jordan. We look forward to your presentation.
Bill, thank you very much for the introduction. And if everyone can go ahead and mute themselves, I'm going to go ahead and get started to sharing with you, if I can. I will need Ed's help as he's on the phone as well to allow sharing permissions. I see he's trying to multitask here, but that way I can share my presentation.
Got it, Ed. Okay, I got the speaker on. Okay,
excellent.
Whether I'm talking or not in there, but I can listen anyway.
Bill,
okay.
We hear you.
Yeah, okay, thanks.
Fantastic. Welcome, Bill. Thanks for bearing with the tech delays. All right. So as Bill Everett mentioned, I'm here to present to you a little bit of what we've worked on with the Regional Cancer Center. SeamlessMD is a platform for patient engagement, remote monitoring, and virtual care. And really what I hope to share with you today is what we've developed as a group, answer some of your questions, and be able to show how we're hopefully helping patients at the Regional Cancer Center and then beyond.
Got the light on.
All right. Go. So you've heard my name, done the introduction. I don't need to share that one more time. What I want to share with you is a little of the oncology journey. I myself am fortunate I have not been through this, but I understand many have. There's a lot that happens. From my understanding, from diagnosis is one of those scary, very scary times and moments, but there's a lot that happens in a very short amount of time and can be drawn out over a longer period of time through to pre-surgery exercises, medications, getting to your surgery. But then everything after the fact is really where we know patients need a lot of help, guidance, support. It's always an issue and a challenge, especially in this fragmented Canadian healthcare system, to understand how patients gather themselves and move through the system and are supported along the way. And Obviously, the Regional Cancer Center does a fantastic job of helping patients through that active treatment phase, but really, there's always a need for better information, more timely information, and that's really where our group, SeamlessMD, my company, comes into play. We are here to help with that patient engagement, remote monitoring, and virtual care. And our program is an app. It's available on tablets, computers, but also available on web browsers. And really, as much it is a digital tool, we really want to make sure that it is accessible to as many people as possible, which I'll talk about a little bit later. I will do a live demo of what this program looks like for a patient, but just to give you some ideas as we go along, we really like to think of ourselves as a digital care plan, and we break it down into 5 main pieces. The very first one are some reminders. So for all of our programs, we like to think, what are those top key, most important pieces of information that a patient going through their active treatment phase, their cancer care, needs to know, and that the hospital and Regional Cancer Center wants them to know. Not only are we able to give these to you in the app, but we're able to push them out to patients via text, via email. In case people don't log into the app, they're still getting those key pieces of information, like make sure you're taking your oral cancer medication, make sure you're doing your exercises and staying healthy by moving and motivating yourself. Make sure you're reaching out for support across your support channels. So we really provide those timely pieces of information to patients as they're going through this phase. We also have a whole set of tasks for patients to check off as a checklist. We know, I'm sure, in any of our healthcare journeys, a doctor, a physician, a nurse will give you a checklist that's 20 pages long on everything you need to do. And I know myself, even with those, they get overwhelming. What we like to do is we break those down into bite-sized chunks, and we really make them easy to understand. We actually write our entire program that we've worked on down to a grade 6 reading level. So anyone, anywhere can go ahead and hopefully comprehend it. And it helps people feel more comfortable with their own health literacy. These are things like, again, gather support, make sure you're drinking liquids, taking your medication, but also getting yourself prepared to come to your treatment if you have to pack your bag, if you need to bring stuff with you each and every time. We make these recurring tasks so they're easy to check off and check, week by week as you're going through the program. One of the places that we really specialize in is an education library. We know everyone loves to read, they want to know what's happening, and we all succumb to Dr. Google. What's happening with this, what's happening with that. We've actually taken it upon ourselves, along with the team at the Regional Cancer Center, to take many materials from their different cancer booklets, research, understanding of what patients ask of them. We've actually been able to take all of that information, bring it to a grade 6 reading level, make it into bite-sized chunks, and have you be able to go through it for very specific topics. It's really helpful to calm and soothe anxiety, as far as we know and understand, for patients to know what's happening to them. Some patients may take a really long time and read every single item. Others just may read the headlines and be able to say, that's enough for me. I'm going to give you a little bit more into that, onto what we have in our program, specifically at the Regional Cancer Center. The real main part of what we do is helping patients understand where they are and how they're feeling and who to contact if there are issues. Right now, again, booklets, handouts, these pages can get lost, these papers can move everywhere. We want to be a single source of truth, and we're actually able to provide patients with a way to not only classify their symptoms, but then through a survey, but then be given some automatic self-care tips, or be directed to call the Regional Cancer Center, or if something's really of concern and the patient wasn't aware of it, maybe even direct them to the emergency department. So we work through some smart algorithms. We take into account all the answers that a patient would give us about their, pain, their anxiety levels, their fatigue, think mouth sores, basically anything that a patient would have in their Your Symptoms Matter surveys. We've been able to condense and expand in certain parts so that we can give patients an appropriate recommendation for their care. And when I go through as a patient, you'll see I'm going to click off a lot of different symptoms. They're really easy to go through, and it's helpful for patients to self-identify. What I will say from there is, on the other end, something that I'm working on with the team at the Regional Cancer Center is being able to catch those problems earlier from a nursing perspective. Right now, we're really using this as an education tool, helping patients get the information that they need. But eventually, there may be a remote monitoring individual, either a nurse or a nurse practitioner, that can take a look at the responses in real time, get alerted of, hey, so-and-so, Jordan's gone ahead and said he has a fever. And we know that patients that are on, say, chemotherapy and have fevers really need to be looked after very, very quickly. Quick and easy, during business hours if there's a way, but being able to pick up the phone and give that patient a call to reassure them is something that we want to hopefully get to support all the patients in the region. Not there yet, but baby steps as we go along. The last thing I wanted to mention, as we've been going through, is some of our accessibility pieces. I know this was a question and concern that I've shared previously. I wanted to talk a little bit more about it. When it comes to patient accessibility, as much as we're on a screen, there's still so much more when it comes to screens. I myself worked at an organization for people with low vision for about 3 years, and I understand the need for large fonts, contrast filters, being able to have screen reader technology. We have all this built in directly to the app to the highest standard for patient accessibility. But in the very last case scenario, patient doesn't have a phone, a tablet, a computer. We actually have the ability to enroll a caregiver. Think spouse, son, daughter, friend, who can get signed up alongside the patient and be able to go through not only the surveys, but the education library alongside them. It's a really great tool to connect your support groups together, have people follow your journey, and get those 20 or 25% of people who don't have the technology onto the platform to be able to use. I think what'll be great now, you've seen some screenshots, you have an understanding a little bit of what we were going after, what we're trying. I think what would be great is if I show you a live program demo. So just on my screen here, I'm actually signed in as a patient. And this is the homepage that patients will be taken to, whether it's on their app, tablet, computer, on their phones. What you'll see is we always have the Thunder Bay logo. It's great to be able to share across the region. And you'll see here some tabs at the top, our home tab with some of our messages, like I mentioned previously, that to-do list with my to-dos that I need to do, and that library page that we need to go through. So very first thing, because I'm starting new, I'm a fresh patient, I've actually already filled out a setup survey to share my symptoms. I've actually put myself on to talk as a prostate patient because I thought that was the most relevant. But here we have Welcome to Seamless, a little step-by-step guide, and we're always trying to push more education out to patients to let them understand. What's really great is we have this welcome message. Once patients have said they read this, it disappears for them, and that they can go ahead and get onto those other tasks. So for example, explore the education library, as well as using my to-do list. Beyond the messages, we have those to-dos like I was sharing before. And again, we've gone through this list quite extensively with the Regional Cancer Center. There's always room for improvement, but some great items like asking your friends and family for support. Support groups are fantastic. Learning about chemotherapy, because I said I was a chemotherapy patient as well as an immunotherapy patient. And any of these items, whether I say I've asked my friends and family for support, I can check it off, which is really great. Or maybe I need to learn a little bit more. And what I pull up is some of the education pages that we have here. So what is chemotherapy? When is chemotherapy used? And all the different items here. And these are the same items that are in the library. It's just a different way of accessing it. We have a lot of topics to cover, but essentially patients are able to go through this and learn more as needed. Some other items that I mentioned, because I checked off my setup survey, that I take oral cancer medication. Again, a little bit more information there. And you'll see here, because these have the little green arrows, these actually come back every day to make sure that I'm reminded to do so. Now, as I've gone through these to-dos, there's lots of information about it. I did want to show you a little bit more of our library. So our library is split up into different sections, things like non-medical, where it's the Regional Cancer Center, about cancer and cancer treatments, side effects, resources and support, and even a small section about survivorship. Patients can type in, I'm having nausea, and we will be able to find out a little more about it. But if they want to use the full library, there is on the web a full itemized list on the left to be able to go through. And we have a whole slew of topics. For example, the different cancer stages, so the TNM for tumor node and metastasis. And then because our program is general right now, as much as we try to focus it for a patient, sometimes patients like to read about all different types of cancer. You'll see here we have plenty different types of cancer that patients can read about: blood cancer, breast cancer, head, neck, etc. I'm going to show you a little bit more about our prostate cancer section. So first, we start just giving people an explanation of the male reproductive system. Again, everything's written at a grade 6 reading level. We want to make sure that it's really accessible to those with lower health literacy. This is across all of our programs everywhere, and we've gotten some rave reviews about it. And you'll see all the forms of these items are in the question answer form. I'm asking what are the parts, and I'm getting an answer just like I'd be asking a doctor. We also have some more information about the urinary system. And as mentioned before, that accessibility, we're able to make some of the font quite a bit bigger just with the click of a button. And then finally, just a little bit about prostate cancer. A little bit more: prostate cancer happens when the cells in the prostate grow in an uncontrolled way. The adenocarcinoma is the most common type. What question should I ask my doctor? Really just giving patients the opportunity to learn a little bit more about it, share a little bit more, and be able to ask their questions to their doctors to get more information. So great information here to start. Really, I think what's even more fantastic are information about chemotherapy. And then we worked a lot with the specialty pharmacy on different side effects for the, where do I have it here? All of the different medication. So how to take my oral medication, and then a whole slew of specific medication, the side effects, exactly what can happen with patients. So we go through each one in a very detailed manner and be able to give patients the opportunity to learn more. Lots of medication, lots of side effects. It's not an easy task to go through, but we feel like we've captured quite a bit of information here. What I'd like to show you now, just as a patient on here, is going through that health check. This is just a separate menu, but I think what would be really great is to show you and go through together some of the symptom tracking that we like to start with. So very first question, because I said I was taking oral cancer medication, the program knows to ask me, did I take it? And I'm going to say, no, I'm on my rest days. And now we're going to start with a head to toe check. This really helps patients understand what's going on around them. So think any types of pain. These are some more serious concerns like fever, chest pain, or trouble breathing. I'm going to select a lot of these so we can see the different logic that goes through in the algorithms. So because I selected these, I'm going to get some more prompting questions. For example, my pain. Am I in a lot of pain or a little pain? I'm going to say I'm in some moderate pain here. Easy to click and hit next on. And I'm also going to say I have a little bit of trouble breathing. Maybe I have out of breath. It's just seeming a little bit more than normal. Do I have any signs of bleeding? Again, being able to identify these items helps the program know where to direct patients at the end. So I'm going to say I have a little bit of coughing up blood, and you can select as many of these as possible and then uncheck with the no, I do not. So the program is smart that way too. And then looking at other problems. So think stomach problems, fatigue, and a little bit of anxiety. again, prompting these, going to talk about my anxiety. I'm going to say I'm at high anxiety level. I am giving a presentation, so always anxious around those, and definitely tired. I have a 5-month-old baby, so sleep is definitely escaping every single day. And then any additional side effects we're able to check off. I'm not going to click too many because I think we're getting the idea, but I'm going to check off, I know a few that have some more prompting questions. And additionally, if there are more side effects, I'm able to write it in. Maybe I have headaches. All right. How many times did I vomit or throw up? Depending on the amount of times. Again, the program is smart and will direct me to the appropriate piece. I'm going to say I just vomited 1 time. What number describes my mouth sores? So I'm going to say I have some pretty bad mouth sores. Because I said that, it will also ask me how many do I have, and if they're in groups, and then if they're painful or not. I'm going to say some mild pain. So again, some pretty significant concerns, as well as my skin rash that I clicked off. So does my rash cover more than half my body? I'm going to say yes to this. And I'm going to say, no, I didn't take my anti-rash medicine. So the program will hopefully remind me to do that as well. And then finally, some healthy lifestyle choices. I'm going to say I did as many of these as possible. Probably didn't sleep for at least 7 hours, but exercise, ate my 3 meals, had a good soup today, and drank definitely enough liquids. And what made it hard for me to sleep well? Baby woke me up early. And then finally, just a little bit more about some exercise. Always good to understand how we're moving forward with that. And then the final piece is, have I done any of these healthcare services? It's just good for the team and yourself to know, have I gone to any of these places? Let's say I called my oncologist, probably want to ask me, tell them about this visit, had serious headaches recently. And then a last piece, just for notes for patients to write down, really easy to say, a good note section. So ask about ongoing headaches during the day. It's a good note for me to be able to review. And now that I've finished my questions, there's an ability to edit questions, just like on most surveys. But I'm going to submit, and I made myself a fairly sickly patient, but the program is going to direct me accordingly to the right resource. So because I had some more serious concerns, the very first recommendation is go to the ER because of these different concerns, and I can learn more about them. Having a fever, very, very important to note. And we have not only what to do, but where to call, toll-free, after hours. Very, very good to be able to share for patients and give them the direction as needed. We also have the Call Your Healthcare team, which directs to the Regional Cancer Center. So because I had pain, anxiety, tiredness, and coughing up blood, I'm told to call these different groups. So again, it's the Regional Cancer Center number and toll free. And then finally, here are some items that I can assess on my own, hopefully getting enough sleep, a little bit of vomiting, some mouth sores, and some rashes. And once I've gone through all of these, I actually have a little review page to be able to see my progress. So the idea is that patients fill this out typically once or twice a week during their active treatment. This program is available to patients basically from sign up for about 8 weeks. And we do focus on patients who are in active treatment to help them identify these concerns and get help where needed. So again, you'll see some graphs, my pain, my trouble breathing, and being able to graph these over time as more data points become available. I think I've talked for enough minutes. I'm going to pause there and still leave my screen open here in case anyone needs to look at something. But Bill, I'm seeing this presentation now 2 or 3 times. Did I miss anything before we open the floor to questions?
Well, I think that you've covered certainly the basics, things that are there. One of the things that I would comment on is that the hospital has been using the SeamlessMD for surgery, a number of different kinds of surgery. I think they said there were 10 procedures that they were using the Seamless, and which is the basic program, not the oncology one, but the basic one. And they've been doing it for a little bit for hip, knee, shoulder, spine, bariatrics, colorectal, breast cancer, TERP, that applies to us guys, HOLEP, and kidney stones. And after a reasonably short period of time, they were doing surveys on how people felt about using that particular app. And this is what the message that came out. And I think Mark and our group got a copy of it anyway. To date, and this was dated, I think, February the 1st, to date, over 1,500 patients have already enrolled onto the app at TB, the regional hospital, with 98% recommending the program to others, 94% saying the program helped them feel more confident before surgery, and 96% saying the program helped them feel less worried while recovering at home after surgery. So that's the surgical group, and we're talking about the oncology group, and Jordan has given us the broad oncology, and there are lots of different areas of it. And I know that we tend to be most interested in the prostate side of it, but we may have family or friends who would be in other parts of it as well. So we'll open it up to questions or comments at this time. So if you have a question or you want to make a comment, just raise your hand and we'll call on you.